Greetings from the Swine Health team. Today we'll be covering the Umbrella Cooperative Agreement goals and objectives for the swine commodity. The goals for the Umbrella Cooperative Agreements as pertains to the swine commodity are focused on mitigating the risks that program and foreign animal diseases pose to the swine industry. Today we'll start with a quick overview of the industry structure and explore how that informs risk. Then we'll touch on each of the swine commodity objectives, covering swine brucellosis and pseudorabies surveillance, African swine fever and classical swine fever surveillance, the Swine Health Protection Act, preparedness and response, and education and outreach. Since the 1990s, there has been a shift towards fewer swine operations, with the number of swine farms decreasing by about 70% over this time frame. Yet pig inventory continues to grow, with the 2022 census reporting that the U.S. has approximately 74 million swine. This suggests that individual enterprises are housing larger herds. When we look closer at the data, we can see that that is indeed the case. Since 1992, the number of swine housed in herds greater than 1,000 head has more than doubled, such that these large commercial herds account for greater than 97% of the U.S. swine inventory. In contrast, smaller operations housing less than 100 head account for only 3% of the swine inventory, but about 80% of the swine operations. The large commercial operations typically house their swine indoors and follow robust biosecurity practices, whereas the smaller non-commercial operations may house their swine outdoors, and this can place them closer to feral swine. These smaller operations may have less robust biosecurity practices, their pigs may travel to exhibitions, and they may lack established and vetted sources of replacement animals. And in states where it's allowed, they may practice garbage feeding. It's these higher risk herds on which many of the goals and objectives of the Umbrella Cooperative Agreements are focused. So let's talk in more detail about the objectives. Starting first with the swine brucellosis and pseudorabies surveillance program. This program has two goals, the first being to demonstrate proof of disease freedom in commercial production herds, and the second is to improve early detection through targeted surveillance of herds at higher risk for infection. For this first arm of the surveillance program, APHIS has agreements in place with several cull sow boar plants that provide for the collection of these samples. This arm of the surveillance program is operated on a national basis such that Umbrella Cooperative Agreement funds would generally not be expended here. Where Umbrella Cooperative Agreement funds do apply is in this second arm of the surveillance program. This second arm is referred to as the Higher Risk Surveillance-Based Alternative Sampling Component, or SBAS for short. Again, the purpose here is to detect infection in higher risk herds. And those are swine that are raised outdoors or with access to the outdoors, originate from herds where management practices allow for direct or indirect feral swine contact, or are housed on operations that may procure swine from other higher risk sources. These are going to be swine primarily residing on those smaller operations that I referenced previously. Every state is assigned a target for higher risk sampling, and that target is based on the status of the regional feral swine eradication efforts and the swine industry demographics of the state. Sampling efforts are led by federal or state field personnel, and samples can originate from slaughter facilities. These are typically state-inspected or custom slaughter facilities, or samples can come from markets or from on-farm collections. Officially identified swine, or swine that can otherwise be traced to a premises of origin, are eligible for sampling, and they do not need to be breeding swine. Each state's targets are found in the Swine Goals and Objectives section of the Grants and Cooperative Agreements Guide, and they're depicted here on the right. The Umbrella Cooperative Agreements objectives that apply to the SBAS surveillance component are to develop relationships with higher risk swine operations and their processors to implement sample collection protocols for this serologic testing. Another objective is to perform this surveillance activities to collect these samples and to ensure that all of these samples are shipped to the Kentucky Federal Brucellosis Laboratory using the code SBAS on the shipping label and submission form to designate the samples as part of the higher risk component. Another objective is to appropriately follow up on any non-negative diagnostic test results and to document those investigations in EMERS. Reporting requirements also include the completion of the triennial application for validation of a brucellosis-free area and the annual application for renewal of the PRV Stage 5 free status. Umbrella Cooperative Agreement funds can be used to support SBAS activities. And funds are typically covering efforts related to contacting producers, markets, and plants to get these sample collection procedures set up. There are a few exceptions to the use of Umbrella Cooperative Agreement funds. States may not use swine health funds for the purchase of laboratory equipment. Shipping costs associated with sending samples to the Kentucky Federal Brucellosis Laboratory are covered elsewhere and should not be included in the funding request. There is no charge to states for the testing done at the Kentucky Federal Brucellosis Laboratory, such that these testing costs should also not be included in the funding request. Lastly, pseudorabies and swine brucellosis surveillance testing won't be supported out of Umbrella Cooperative Agreement money if states elect to do that testing at their local APHIS-approved laboratory. States can do this testing at their local laboratory at their own expense. And any non-negative samples must be forwarded to MVSL for confirmatory testing according to established protocols. So let's switch gears and talk about the ASF-CSF surveillance program. The Swine Hemorrhagic Fever Surveillance Plan surveils for both African swine fever and classical swine fever. And this plan has three primary objectives. The first being to strengthen our detection capabilities. The second is to enhance our outbreak preparedness by testing our capabilities of collecting samples at a high volume, testing the laboratory's capacity to test those samples, and our data management systems to handle the reporting of those results. And then lastly, the third objective is to support our claims of disease freedom. There are three swine subpopulations targeted by this plan, shown here in the blue circles. And this includes large commercial swine operations, higher risk swine raised in non-commercial settings, such as those with access to the outdoors and those with potential feral swine exposure. And then lastly, free-roaming invasive feral swine. There are 5 surveillance components employed for sample collection, and this includes foreign animal disease investigations, the sick pig veterinary diagnostic laboratory component, which targets ill or dead swine on farm from which samples are collected by a herd veterinarian and submitted to a veterinary diagnostic laboratory. There's the slaughter and aggregation point surveillance component, which targets condemned, ill, or dead swine presenting at slaughter establishments or aggregation points. There is the higher risk surveillance component, which targets ill or dead swine raised in higher risk herds. And then lastly, the feral swine component is executed by USDA Wildlife Services. State and federal staff are most frequently engaged in executing the slaughter and aggregation point component and the higher risk component. And Umbrella Cooperative Agreement funds can be used to support this work. The cooperative agreement's objectives that apply to the ASF-CSF surveillance program include the following. Identify and sample swine from higher risk premises, including garbage feeders, markets, and other aggregation points, as well as slaughter establishments, based on the presence of clinical signs or condemnation reasons that are suggestive of a hemorrhagic disease. States will want to prioritize the collection of samples from the highest risk swine as determined by their local risk evaluation. And these samples must come from swine that are traceable back to a premises of origin. So please ensure compliance with identification requirements. State and federal sample collectors should use the Comprehensive Lab Submission Module, or CLSM for short, or the Ideagen application, also known as MICO, to record sample information and generate packing slips for submission of ASF, CSF active surveillance samples to the designated laboratory. The swine health team and your local network associate can help with navigating access to and the use of these applications. Samples should be submitted to the appropriate laboratory, which will depend on your state and which surveillance component the samples fall under. Your designated laboratory for the ASF, CSF active surveillance samples may not be your local non-laboratory. Please consult the most recent ASF, CSF field collection manual or contact the swine health team for more information. State targets for the ASF, CSF active surveillance program are shown here, with targets for the higher risk component on the left and targets for the slaughter aggregation point component on the right. These targets, as well as the designated laboratory to send samples to, are found in the ASF CSF Field Collection Manual, which can be requested from the swine health team. If your state is not listed as having a target, you can still collect samples for active surveillance. Just contact the swine staff to determine which laboratory to submit the samples to. Swine staff is happy to work with states to adjust these targets as necessary if you have suggestions or ideas on swine populations to target. And again, Umbrella Cooperative Agreement funds can be requested to support these surveillance efforts. Also, if you can identify incentive programs that may encourage submissions from higher risk farms, such as by supporting necropsy expenses or conducting testing for other endemic diseases, please feel free to consider including such activities in your Umbrella funds request. We get a lot of questions from the swine industry regarding what we are doing about the threat of garbage feeding. The Swine Health Protection Act is aimed at reducing the risks associated with this practice and provides the standards that licensed garbage treatment and feeding facilities must meet. State and federal field personnel play a role in enforcing the Swine Health Protection Act. They conduct quarterly on-farm inspections, which are critical to ensure that the cooking and feeding processes are conducted appropriately and that the facility is meeting all of the requirements of the Swine Health Protection Act. Licensed garbage feeders are required to report unusual illness and mortality, and state or federal field personnel must respond to these reports and sample pigs as appropriate for diseases like ASF, CSF, pseudorabies, swine brucellosis, and others. States must investigate all reports of illegal garbage feeding, and lastly, all states, even those that do not allow garbage feeding, must perform searches for the illegal feeding of garbage to swine. The Umbrella Cooperative Agreements objectives that apply for the Swine Health Protection Act include the following: to perform the Swine Health Protection Act activities as required by state and federal regulations, including conducting active searches for illegal feeding of garbage. States should also work to establish relationships with garbage feeding operations to ensure that these producers are reporting illness or mortality events to state or federal staff. States must also submit a monthly report of the Swine Health Protection Act activities, regardless of whether the state allows or does not allow garbage feeding. These reports are completed in EMERS and provide information on the measurable outcomes listed on the right. The EMERS staff have created guides for completing these reports, and your local network associate can assist you as well. The Umbrella Cooperative Agreements objectives that apply to preparedness and response are listed here, and Umbrella Cooperative Agreement funds can be used to support this work. This includes work to develop, maintain, and exercise state-level plans, procedures, and documents for responding to endemic, foreign, zoonotic, and emerging or re-emerging diseases that impact animal agriculture. This can also include the conduct of training for field personnel related to these animal disease response activities, and the conduct of epidemiologic or foreign animal disease investigations for diseases such as African swine fever, classical swine fever, brucellosis, pseudorabies, or other diseases, and follow up on those diseases as appropriate if infected herds are found. Reporting requirements related to such activities includes documenting information related to herd investigations and disease response activities in EMERS. And states should also complete their monthly National Animal Health Reporting System reporting through the NLRAD NARS web interface. The swine health team is aware that there are several states that deal with frequent reports of vesicular lesions in swine that present at slaughter. These lesions are usually determined to be due to infection with Seneca virus A, or SVA, but these reports must be thoroughly investigated as the lesions cannot be distinguished visually from those caused by foot and mouth disease. Veterinary Services has recently updated our guidance that addresses swine with vesicular lesions to allow for improved efficiency in the investigation of those cases that present at an SVA high-incidence slaughter plant. However, we recognize that even with those efficiencies, the conduct of these investigations can be costly. And while this won't be a line item for every state, Umbrella Cooperative Agreement funds can be used on a limited basis to supplement the outreach and investigation activities in states with SVA high-incidence slaughter facilities. We do ask that those states working with their VS colleagues explore ways in which plants, transporters, or source farms can modify their procedures to reduce the incidence of SVA cases. Lastly, we hope that states will work to advance relationships with producers, swine veterinarians, laboratories, and the allied industry. These education and outreach activities and any meetings attended should be reported in the Umbrella Cooperative Agreements quarterly report. Information to be provided is described in the Swine Goals and Objectives section of the Grants and Cooperative Agreements Guide. Outreach activities associated with the U.S. Swine Health Improvement Program are funded elsewhere and are not eligible for funding through the Umbrella Cooperative Agreement process. Before we close, I do want to mention that in addition to the goal-specific reporting mentioned throughout this presentation, the Umbrella Cooperative Workbook should be updated on a quarterly basis, listing progress on all stated objectives. This will serve as the quarterly report for the Umbrella Cooperative Agreement. This wraps up the Swine Cooperative Agreement items. Swine staff wants to thank you for your continued collaboration, and our team can be reached at our group email address to answer any questions you have or to discuss the swine commodity goals, objectives, and funds further. Thank you for your time.